What if I told you endometriosis surgery doesn't just fail to prevent recurrence? In some cases, it may actually contribute to new lesion development. Let's talk about what the research is really showing. Now, before we get into this, surgery absolutely has a role. There are situations where it's necessary, but the idea that surgery removes it and you're done is not supported by what we're seeing clinically or in the research. First, recurrence isn't always regrowth. It may be new disease. Most women are told if it comes back, it just grew back. But that's not always what's happening. Some studies show that recurrence can appear in different locations or even as a more aggressive subtype than before, which raises a critical question. Is this really regrowth or something else? Second, there's evidence of viable endometrial cells spreading. One study found living endometrial cells in cyst fluid and post-surgical drainage. And when those cells were studied further, they were capable of adhering and forming new lesions. So during surgery, if that fluid is released into the pelvic cavity, it creates a biologically plausible pathway for new implantation of endometriosis. Endometriosis is more dynamic than we thought. In a primate model, researchers observed something surprising. Lesions didn't just persist, they turned over and new ones developed over time. Even more concerning, new lesions appeared in animals that were not originally inoculated after repeated laparoscopic procedures, meaning there may be factors related to surgical manipulation itself that influence disease behavior. 4. Recurrence can come back different and worse. Human data also shows that after complete excision, endometriosis can return as a different subtype or a more severe presentation. Let me say this another way. Endometriosis can return in a worse manner than before the surgery. So this isn't just about missing tissue during surgery. It suggests that the underlying biology of the disease is still active and evolving. So let me be very clear. This does not mean surgery causes endometriosis, but it does mean this. Surgery is not addressing the full picture, and in some cases, it may play a role in how the disease behaves afterwards. Surgery itself can create new problems. This is the part that's often overlooked. Surgery is a physical trauma to the body, and with that comes risks like scar tissue, adhesions that can cause more pain, nerve irritation or damage, changes in organ mobility, increased inflammation during recovery. In some cases, women trade one type of pain for another type of pain. Now, if you've had surgery and your symptoms came back, you did nothing wrong. Your body isn't failing you. You were just never given the full strategy. If you're contemplating surgery, discuss this data with your surgeon. Endometriosis is not just a structural problem. Surgery is designed to remove or destroy lesions, but it does not address chronic inflammation, immune dysfunction, hormonal imbalance, gut health issues. So removing lesions without changing the internal environment is like pulling weeds without addressing the soil. Before deciding on surgery, or even after you've already had it, ask yourself, what is driving this in my body? What is creating the environment for this to grow? Because that's the piece that determines whether it comes back or not. Now, if no one has explained this to you before, you're not alone. Comment truth if you want more education like this, because you deserve more than a temporary solution. You deserve a real plan. If this video resonated with you, please like and subscribe to our channel.